Children, particularly children under the age of 5, are the group at greatest risk of being admitted to hospital. So therefore, an influenza vaccine is the one that's most likely to have a benefit to that population. The flu vaccine is released each year. The time to take that vaccine is prior to the influenza season. So in Western Australia, that normally occurs in about July each year. So now, in May and June, are the times when you're most likely to benefit from an influenza vaccine. The influenza vaccine that we're using this year is extremely safe. We have been looking very hard this year and in previous years to make sure the side effects that we see from influenza vaccine are as expected. So far this year we've enrolled thousands of children in Australia looking at the safety influenza vaccine, and the vaccine we're using this year has a very low side effect rate similar to what we've observed each year subsequent to 2010. The normal side effect profile from an influenza vaccine is a small proportion of children will get a fever, a low-grade fever, and as I said, in 2016, that's about 3%. A sore arm is pretty common as well. About 1 in 20 children will get a sore arm. The other side effects are very uncommon, and we don't expect significant numbers of children to have any of those major side effects. With that, less than 1% of people have had to even see a doctor or talk to Health Direct after their influenza vaccine this year. The influenza vaccine is made of a component that's on the outside of the influenza virus. To make it, you take the whole virus, and what you do is you take bits apart and purify one of the core proteins on the outside, and that's what's used as a vaccine. The reason we choose that protein is that's the bit the immune system recognises and tries to target. So by reminding the immune system of that protein prior to the influenza season, we know that it will respond promptly and swiftly should you be exposed to that virus again. The influenza vaccine does not contain any live viral particles, so it is impossible to get the flu from the vaccine. Now, because you are using a protein that is stuck on the outside of the flu, some people will get a fever or a sore arm. That is not the flu.